Okay, chapter one. This is going to be about the dental team in the business of dentistry. Learning objectives for this chapter will be to define the key terms in this chapter, to explain the dual role of dentistry as a business and a healthcare provider, define the various members of the dental team and explain the responsibilities of each member, describe emerging dental workforce models, discuss dentistry as a business, and describe the importance of identifying dentistry as a service profession, define various types of dental practices. Also, list the specialties recognized by the American Dental Association, describe the various types of dental hygiene practices, and discuss the process for starting a dental or dental hygiene practice. Okay, so the role of dentistry. So any dentist's office has two goals. One of them is to provide healthcare services, and the other is to make a profit as a small business. And one cannot exist without the other. We cannot make profit off of people if we're not providing healthcare services that they actually need. And unless we're providing those services that they need, we have to make a profit off of it. We can't be pro bono, we can't reduce rates, things like that, because we still have to make a profit. Every person who works at the dentist's office contributes to that success, both in providing, quality services and in turning that profit for the small business. Okay, so government agencies and the dental profession as a whole have actually been who have stepped in and established the standards of care that we now know to be the way that we practice, right? So, as a healthcare profession, the dentistry needs to follow the standards of care, and those mean having these three objectives for promoting optimal oral health in a culturally sensitive manner. Cultural competency is really important when you're providing that quality care, and it's important to promote an environment of kindness and concern. Um, that caring environment is going to help you promote oral health education because your patients are going to be more likely to listen to you and to trust your opinion. And it's going to help you promote prevention because on the one hand, they're going to listen to you, right? So they're going to actually hear what you have to say, but also they're going to be confiding in you and telling you those aspects of themselves that maybe they wouldn't share with someone that they don't trust. And it's really important that when they're doing that, that they feel accepted and understood. So a caring environment is ideal when you're promoting when you're providing oral health education and when you're promoting prevention, because we want them to listen to us and we want them to trust us, we want them to confide in us, and we want them um, to follow the recommendations that we give them. So, still on that first aspect of promoting or providing services in a healthcare setting, we also need to emulate the highest standards of patient centered care. And patient centered care is when we recognize that patient's needs, we listen to them, actually listen to them, not just hear what they're saying, because there's a difference between the two, and we are respecting that that patient has a right to choose. That patient can choose to completely refuse treatment. They can choose to only accept part of the treatment, or they can choose to accept it all, of course, right? Um, and so when we're listening to them, though, when we're saying, okay, I understand that you want to whiten your teeth, but I need you to understand that you have periodontal disease, let's do both, then that's you hearing that patient and also understanding what the patient needs, right? Um, for the next one is to acquire the most advanced knowledge and skills to meet the changing needs of a diverse patient population. This one is important for your own professional growth. You have to continue to learn. You have to continue to grow and stretch your skills. School is not over once you graduate dental hygiene school. You are always going to be in school. You are always going to be learning something, and you might not be taking tests or getting grades, but it is very important that you get comfortable in that lifelong love of learning. And if you look back 20 years ago when we weren't practicing with digital radiography, and now we are, think about how far we've come. Just 5 years ago, when I first started practicing, I was writing charts by hand at some of the offices, and that's very rare these days. So you really need to you need to keep going, you need to keep learning, you need to keep growing so that um, as things change in dentistry, you are ready to meet those challenges. Maintaining professional skills and updating yourself on your procedural techniques are going to be crucial to providing that high quality service. I'm sorry, my dog is like chewing a bone in the background. Um, for me, it came in taking continuing education classes that I felt like I wasn't strong in. So every single year, no matter what it was, I would take a class in pharmacology because you can never know too much about pharmacology. I mean, I understand a lot of the medications, but I still don't know everything. And so I think that's probably going to be one of those things I always find is as a weakness for me. Um, Another one is ergonomics. I took several classes on ergonomics and my ergonomics got better. You should have seen it. It was terrible when I first started. And recently, well, gosh, it was probably like 2 years ago now, I took a class on sleep apnea. And I thought I knew a lot about sleep apnea, but I was wrong. I went to that CE and I was mind blown the entire time. The speaker was fantastic. I just learned so much about how important it was in our dental office to diagnose, or to not to diagnose, but to recognize the signs of risk of sleep apnea. And so you better believe it. I went home. I typed out everything that I'd learned at that CE, and I went to my dentist the next day and I said, "Here, we need to be doing these things. We need to be incorporating all of these things in our office." And I, got a bunch of the material together, and I, put a little continuing education sort of pamphlet together, and I would, whip it out whenever my patients had a high risk of sleep apnea. And um, that is exhibiting a willingness to share knowledge with other people. If I had gone to that CE class and I learned all about sleep apnea and then I never did anything with it, I just knew, right? But I wasn't talking to my patients about it, I wasn't talking to my dentist about it. And so that would have been wrong. I need to share that knowledge because otherwise, why am I doing this? And the other thing here is participate in professional activities. So participating in professional activities is getting involved. You want to give back to your community. You want to be involved in your professional association. And I know that it probably sounds like something that you maybe that you don't have time for right now, right? When I first finished hygiene school, I also felt that way. That I need to work 5 days a week. I'm too tired to do those kinds of things. And after a while, I started to feel like I was on a hamster wheel. I was doing the same thing over and over and over again, and it wasn't until I started to get involved with other people that I started to, fall back in love with the material itself, with the profession itself, because at the root, it's a very giving and it's a very rewarding career. But if you get away from that and all you're ever thinking about is, the money, then you will not get as much from it. So I really encourage each of you to stay active and to give back whenever you can. Okay, so when we switch over and we think about the dental office as a business, it's a small business, which is usually owned either by a company or it's owned by a person, by the dentist. There are certain criteria that we need to keep in mind. We have to practice ethically, because if not, then you end up getting in trouble with certain regulatory bodies, and they will shut you down. You have to operate efficiently, right? You want to save money where money can be saved. You need to operate safely, because if you are putting your patients at risk, they won't come back and you won't have any profit. You need to be productive. So the people who work there need to be doing things that make us or the team money. You need to generate referrals. So the best marketing tool that is out there is word of mouth. It's someone else saying, I had a fantastic experience at such and such DDS. You need to maintain a low stress environment. So when the patient comes in, they need to be comfortable being there with you. You need to use technology. More and more these days, we're going to talk about generational aspects of the dental team, and also just generations in general, how each of the generations use technology. More and more so, we're finding the younger generations not only appreciate technology, but they expect technology to be present when they go into a business. You need to increase entrepreneurship, and you need to maintain financial independence. That not only does the business need to be making money to turn itself over and to have overhead, but it needs to be able to grow if it needs to. It needs to be able to, fix certain aspects as it needs to. It needs to be independent. It doesn't have to have loans and things like that constantly hovering over them. As a business, that dental practice has to meet certain criteria. Those, the business is an enterprise that is used by everyone involved to provide a livelihood. Every person there is making money to live. And so every single person has a stake in how successful that business is. If you're not doing what you're supposed to be doing and you cause the dental office to shut down, well, you also are out of a job. So don't do that. Be productive when you are at work. The modern dental practice needs to be a people-oriented health profession. And what that means is that we need to be focused on making sure that our patients feel comfortable and that they are satisfied before they leave, so that yes, they go out there into the world and say wonderful things about us, which brings in new business, but also they return and bring us their business back. That is important. The most important asset for any dental practice are the team members. Any business will tell you this, any company, anything like that. If there is someone out there who is more focused on the profit over the people, it will not be a successful business. If you're not taking care of your team members will find new jobs. Okay. Anytime I wasn't happy at a dental office, if I didn't feel appreciated and well cared for and well paid, I would be looking for a new job. So anytime you have someone who isn't focusing on the employees and keeping your employees happy, then it's not going to be a successful business. The um, the administrative assistant in an office, and we'll talk about each of the roles that each person plays, but the administrative assistant is crucial to the success of the business. So while I absolutely understand as a hygienist and as a dentist, you would feel like you're one of the most important aspects of the company, because you are actually providing the services, right? I've felt that way at some point. Where, hey, why am I not getting the credit that, maybe a business assistant might get? And it's because they're doing the actual legwork to bring in the money. While I'm providing the service to the patient, they're the ones billing the patient and billing the insurance and writing the claims and bringing in the checks and cashing the checks and balancing the books. And you have to appreciate what that front office does in order to understand how the front office and the back office work together. Front office is kind of like the business side of things, people who schedule, people who bring in money, people who do insurance claims, that kind of thing. The back office being where, actual services are performed. Okay, so a dental team is comprised of some or all of these team members here, um, depending on how big the office is and kind of the individual needs. There is always a dentist, obviously, right? Everyone practicing there is practicing under the dentist's license. They have either a DDS, a doctor of dental surgery, or they have a DMD, which is a doctorate of dental medicine. Both of them are pretty much the same thing. It's just depending on what school they went where and the letters that school gave them. Then there is a dental assistant, obviously, who helps the dentist. A lot of you guys know assistants. As a hygienist, you should be able to perform all of the services that a dental assistant, even an expanded function dental assistant, could do in your state. So here in Texas, everything an expanded function dental assistant can do, you can do, like polishing and placing sealants. Those are the two kind of expanded functions. Then the dental hygienist, obviously, that is us. And then there is an administrative assistant. That is the person up front who is answering the phones, who is submitting insurance claims, who is collecting payments, who is processing payroll, who is doing all of those things. Sometimes you'll have an office manager, and sometimes you'll have like an administrative assistant. It really just depends on whatever title that your office likes to use for that person. Sometimes it'll be a dental assistant because they are very familiar with the dental terms. But sometimes it's not. I've worked in offices where the person up front has never been in anything dental. They just like clerical work, and so they were well suited for some of it, and they learned it as they went, and that there's nothing wrong with that. Especially if you've had any experience with insurance in the past, it's a pretty insurance heavy more so than like dental terminology heavy. The next one is a sterilization technique. This is typically an assistant who runs the sterilization room in an office that is, pretty big. You would have someone who kind of manages how things are being processed in sterilization, sort of like our rotators would do. You would have someone who stocks and who helps out where they can and who runs sterilization. This is again typically a dental assistant. And then the next one is dental laboratory technician. This is not a dental assistant. This is a completely separate profession, and these people work in dental labs. These people are artists, okay? They can create teeth out of almost nothing. It's like they have material, they get an impression, and they create these wonderful things. I've been to a lab and they did the shades for my crowns on my two front teeth, and it's impeccable. He noticed things about the hue and saturation and translucency and all of that material and how the shade transitions as like it nears the gingival margin and how it nears the incisal third. And it's just they're just fantastic at what they do, and they are artists for being able to create the things that they do. Um, and so, while every office is different, these are kind of the more common things. Although a dental laboratory tech would not work in a dental office. It's really important that the dentist works close, depending on, if they're the owner of the office. The dentist is not only, the dentist and does all of the services, but they're also like the business owner. And so they have to do a lot of the hiring and payroll and all of that usually you could have like a business associate do. All right, so just like we were talking about in that last slide, an expanded function or extended functions dental assistant or an EFDA is a dental assistant who has taken extra coursework and is certified to provide services beyond the typical scope. So here in Texas, the available Expanded functions are going to be coronal polishing and placing sealants. Then there is community dental health coordinators. And these people are trained to provide preventive service and patient education, and they assist with unmet dental care needs. It's unmet dental care in needs to access in areas where there is like a higher need. There's like lack of access to care kind of areas. Then Minnesota is actually the first state that ever authorized a mid-level provider, which is the dental therapist and advanced dental therapist. This is typically considered of a dental hygienist's position, as if the nurse were moving to the nurse practitioner. Then the dental therapist is kind of like the in-between of a hygienist and a dentist. The Alaskan Native Tribal Health Consortium, which is ANTHC, in collaboration with Alaska's Tribal Health Organization, THOs, developed and brought dental health aid therapists, DHATS, to Alaska during the early 200s. And then the scope of those 4 different DHAs are pretty different, and it's all extra education. So, you would have your training and the entry level dental hygiene, and then you would go on and do some other type of coursework, which would give you these expanded functions. But it's all dependent on the state. Here in Texas, we do not have an expanded function dental hygienist. All right, and so still talking about that dentistry from the business aspect, we want to look at the administrative professional's role in the dental office is constantly changing. And so newer offices have people who are forward thinking, they take initiative, and they embrace change. You're going to find that there are a lot of offices where the people have been, working in dentistry for years, and they don't want to do anything new. They want to keep doing the same old, same old. And while there's something wrong with that, there are certainly patients who prefer not having things changed. More and more, we're seeing different generations that want and expect things to be updated. And so successful dental practices are going to be led by individuals who are capable of seeing the opportunity, seizing the day. They see, oh, you grind your teeth, it's time to make you a night guard. All of those things. And let me show you images of, your teeth so that I can tell you what you have going on. That is going to be how you stay successful as a dental office. And so there's a lot greater emphasis on leadership and management in today's offices, because people don't want to work in offices where, their boss is mean to them. There's no authoritarian sort of style of that life anymore. And so we more and more expect the people who are in charge to have actual leadership skills, not just to be assigned a leadership role. And that can be, difficult for some offices who, have a hard time finding someone with those leadership skills that is willing to, be paid what they think that's worth. The titles in the dental office are going to change from office to office. We had one where she was the office manager, and she actually kind of oversaw both offices. But then when they hired a new front desk at the office she didn't go to as often, that girl started calling herself the office manager, and there was a big drama there. So it's important that when you're being hired, the title that whomever hires you, that's the one you should keep. And so there's administrative assistants or business managers, all of those things. Those are some of the titles that they can have. And also, when we look at leadership and management, it's important to remember that dental school doesn't teach these skills. dental school teaches dentists how to perform dentistry, not necessarily teaching them how to run a small business. They're not necessarily taking classes on, how to manage a team. So when we have these sort of expectations, because we show up and we think, well, they're a dentist, so they should automatically know, that's not necessarily true, and you should give them a break because not every dentist was set out to be a business owner. Some of them really just set out to be dentists, and they just wanted to help people clinically, and now they're having to deal with both. So um, cut them some slack. Okay, so in dentistry, dentistry itself is a service profession, and since it's a service profession, we provide services to our patients for a fee. And so a service itself is an intangible product. It means I'm giving them something that they can't necessarily hold or touch, but I am still giving them something. And that is typically provided in the form of patient care. Service is defined as a system of accommodating or providing assistance to another person. So when I help someone into the chair, or I help them out, that is a service that I'm providing, right? Everyday activities and habits can foster that service centered dental practice, like uh, you know, keeping your hours regular. You're not constantly taking the day off here and there and having patients have to be moved around. You're going to follow an appointment schedule. When you say that you're going to see that person at 1 p.m., well, you need to be back from lunch at 1 p.m. and ready to go beforehand so that you're ready to take them back and sit them in the chair at 1 p.m. Because some people have a, a very prompt time schedule and they will be very upset with you if you run late. You're going to maintain your office equipment. So it's never a good idea to complain about your equipment to your patient, because how are they going to feel comfortable and secure getting services from you if your stuff is always broken? Like that doesn't make them feel safe. That doesn't make them trust you. So you need to maintain your equipment and have it serviced as it should be so that it's functioning properly. And you need to be genuine. Okay, you need to be honest with people. If they ask you if you think that they should buy that electronic toothbrush and you don't think that they should, tell them that. It's okay. It's okay to say, it's a wonderful purchase and I think that, you could benefit from it, but do I think you need it? No, I don't. And there are ways to go about telling people the truth without having to be unprofessional, without having to be rude or anything like that. But you do need to be honest with your patients. Be genuine. Let them see, because if you fake it, they're gonna know. There's no hiding it. So just like being genuine and honest, patient retention really comes from communication. So when I'm sitting my patient up and I say, okay, I recommend you come back in 3 months, let me get you scheduled for that. And they're going to be like, 3 months? I thought I was coming in every 6. And I'm like, well, we talked about this. You have periodontal disease. We need to see you more frequently because you have deep pockets and blah, 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 right? You're going to talk all this out to them. And then they're going to still be like, I want to come in every 6, right? But that's okay. That's okay, because they have the right to choose, right? So as long as we give them the information, this is what I recommend for you. If they're still like, and I want 6 months, then you just say, okay, well, then I guess I'll schedule you for 6 months because they get to choose. And you need to be attentive to that. You need to be hearing what they say. If they seem upset about the fact that you want to schedule them every 3 and they aren't in complete agreement and you schedule them in 3 months, they're not ever coming back to your office. So you need to be paying attention to them. And then in 3 months, when that appointment comes around and they didn't confirm, or they never called and canceled, and there you are with no patient for an entire hour. Like, don't do that to yourself. Just listen to your patients, actually communicate with them. um, the ability to understand and to be understood. So, service is not a result of clinical and cognitive skills, but rather of attitudinal skills that evolve into a commitment to welfare of others. This is the importance in being able to read the body language of the individual that you're talking to and understand that. The words that they're using may or may not be what they actually mean. So if someone shakes their head no, but they say yes, the answer is no. Um, Typically, body language is more like it's weighted more than the actual words that you say, right? And so it's important to pay attention to all of the communication that you should be receiving. And so when a patient leaves dissatisfied, then they're going to say something to other people, and your reputation as a whole will suffer. And then typically patients will leave dissatisfied from your office more so from the service that you provided. If they had to wait 30 minutes to have their teeth cleaned, or you didn't listen to the fact that they wanted whitening and all you wanted to talk about was perio. They care more about communication with you and being heard and feeling understood and feeling accepted than they do about the services that you provide. So maybe you're not doing the best cleanings. Maybe, your physical skills aren't quite great. Maybe your dentist leaves an overhang on one of their fillings. They won't necessarily leave your practice because of that, but they will 100% leave your practice if they don't feel like they can trust you or they don't feel accepted in your office. All right, so there's two types of offices. There is a solo dental practice and a group dental practice. This is exactly what you think it is. So a solo office, there is only one dentist, and a group, there is more than one dentist. When there is one dentist, all of the production that comes in, it's billed under that one person's license. And all of the money comes in, everyone gets paid based off of that money, and everybody leaves and there's no problems, right? When there's more than one dentist, sometimes both of those dentists work for a company, and so they get paid evenly no matter what. They provide a service, they get paid a certain percentage of whatever that service brings in, right? Um, or sometimes, like in the office that I was in, one dentist owned the practice and one dentist worked for him. And so the dentist who owned the practice, every service that he provided, all of the restorations he did, things like that, those were all 100% his own. But the other dentist, whenever he would perform a service, he would only make a percentage, just like as if he were sort of making commission off of his services. So he wouldn't get paid as much, but he didn't have to shell out part of his pay for the overhead. He doesn't have to pay any of the employees. He doesn't have to worry about, buying supplies. He doesn't have to do any of that stuff. He just shows up for work and he sees the patients who come in, and then he goes home and he collects a paycheck just like everybody else. So, a general dentist is a dentist who sees all phases of dentistry. They do children, they do pedo, right? They do adults, they do geriatric care, they do dentures, they do crown and bridges, they do endo, they do ortho, they can do implants. They can do anything that they think that they want to do. They are licensed to perform all of those surgeries. They can do extractions. Um, and so the DMD or the DDS degrees are awarded after they complete a dental program, and they are able to perform all types of dentistry. However, When a case is more extensive, then the general dentist will typically refer out to a specialist. And a specialist can be any number well, this one says the American Dental Association recognizes nine. Nine feels a little bit much because oral maxillofacial pathology, oral maxillofacial radiology, oral maxillofacial surgery, really, do these all need to be all separate? But anyway, so to become a specialist, the dentist, after he finishes dental school, has to go to additional education. Typically, they will call it a residency, sort of the same as like medical school goes to residency, and they will specialize. Once they specialize, they cannot go back. Okay, so if your dentist is a pedodontist, he cannot see adult patients. Okay. He can, like, if you have an orthodontist, right? That orthodontist, even though they're a dentist, they cannot go back and do fillings. Okay. The reason for this is a very special relationship that specialists have with general dentists. General dentists will look at everybody. They see everybody, right? They have hygienists, they do exams on a ton of people. And when there is something that comes up that is beyond what they feel comfortable doing, maybe it's a more, maybe whoever it is, maybe that dentist doesn't ever do root canals, right? So they just hate root canals, or maybe they only do root canals on anterior teeth, but all posterior teeth, they're going to refer to an endodontist. If that general dentist had their patient and they referred them to an endodontist who, while looking at the fact that that patient needed a root canal, they were also like, you know what? You need a crown too, right? I'm just going to go ahead and do that crown for you, right? The problem with that is that the general dentist is the one who said they needed that crown. And that patient would have never gone and talked to that endodontist if the general dentist hadn't sent them there. Okay. So the the endodontist needs to do the root canal and then send that patient back to the general dentist for the crown, because the general dentist is banking on the fact that he gets paid the money from the crown. Okay, and they would lose money if they sent their patients out and then the patients never come back, right? They wouldn't do that. They wouldn't share like that. And so if a specialist is doing things outside their scope, outside what they've sort of narrowed their scope to be, then they're in the wrong and they shouldn't be doing that. But anyway, the 9 ones that there are, it starts out with dental public health, and that one is concerned with primarily the science of promoting dental health and preventing dental disease, but through community projects like community water fluoridation and like sealant programs, things like that. Public health, we all took that class. And then um, the research kind of falls into public health, by the way. Endodontics will focus on the biology, the morphology, the physiology, and the pathology of the dental pulp. They do root canals. They identify the causative factors for the pulpal disease, and they prevent and treat the dental pulp as their primary concern. That's the thing that they are focused on. The oral maxillofacial pathology will be the one who investigates the causes, the processes, and the effects of oral disease. They will be someone who researches and diagnoses oral disease by means of clinical, radiographic, microscopic, biochemical, and other. I wonder what other is. By other examinations. An oral and maxillofacial radiology is the dental specialty concerned with the use of energy radiation to produce and interpret dental images for the management of diseases, disorders, and conditions. So you could refer someone who maybe had a fracture, but you're not able to capture a good radiograph of it. You would send them over to an oral and maxillofacial radiology specialist, and they would maybe do like a cone beam computed tomography sort of scan on that patient, and then they would definitely find the fracture. And then an oral and maxillofacial surgery consists of diagnosing and surgically treating diseases, injuries, and defects. This is the person you send if you think that they might have oral cancer. If you think they might have oral cancer, you probably send them to the pathologist who will biopsy it, right? They biopsy, it says, okay, yes, this is cancer. Then the oral pathologist will actually refer that patient over to the oral maxillofacial surgeon who will do surgery, right? They'll remove whatever it is. But then maybe that person needs radiation. So then they'll refer that person over to the radiologist who will perform the radiation. Do you see how these all work together? Nobody's stepping on anybody's toes. All right, and now these next ones, these are all the ones you're expecting. So there's orthodontics, who deal with correcting malocclusion and skeletal abnormalities. Orthodontists are also really concerned with the function of the teeth, so being able to chew effectively, and the aesthetics, right? Because everybody wants that pretty smile. And then pediatrics, of course, are dedicated to children, and they will typically see patients all the way from 0 to well, I guess 0, like a couple days, right? Old to adolescents, normally around low 20s, somewhere between 21 to 25. They will kick out their patients and they will not let them come back anymore. I've met a couple of people who were like 24, 25, and they're like, this is my first time in a general dentist. And I'm like, what? Like, how? And it's because they've been at their pedodontist for so long. Uh, so periodontics encompasses prevention, diagnosis, and treatment of perio disease, right? So whenever there is a case that is too far gone for a general dentist's hygienist, they will go see a hygienist that works for a periodontist. Periodontists are really cool because they can do the flap surgeries and all that fun stuff. So, I can't blame them. And then prosthodontists focus on restoring the function, the comfort, and the appearance of dentition after you've lost some teeth. So prosthodontists are really the people who will create prosthetics, and not just prosthetics for patients who've like lost one tooth or two teeth, but maybe people who've been in an accident and parts of their teeth are gone, or after someone has had oral surgery and they've healed from that. Sometimes they will have removed parts of the face, and so they will send them over to the prosthodontist who will create some sort of appliance that will fit in and create some of the physical structures. Don't just think about someone who makes a partial. Like a partial is with the general dentist, right? The same way that a 4 millimeter pocket is with a general dentist hygienist. But when it's part of their sinus is actually exposed in the oral cavity because of maybe a cleft palate or something. That's like the level of like a 10 millimeter pocket, right? Like there's no way we're gonna be able to see a 10 millimeter pocket in a general office, just like there's no way we're making an appliance like that in a general office. Okay, so when we look at dental hygiene practices, there are there are some cases where hygienists are no longer working under the supervision of a dentist. Here in Texas, we must still practice under the supervision of a licensed dentist. But there are states where they are passing legislation that is in observance of access to care. And access to care is really like those rural areas where people aren't able to travel so far to get to a dentist, and the dentists aren't willing to go live in rural areas where they can't make a profit for their business, right? But a dental hygienist is kind of the go in between. And so a hygienist doesn't expect to make as much as the dentist would need to expect to make. And so they are able to often go work in areas where it wouldn't be profitable enough for a dentist to go work there. Um, and so in some states, their hygienists will still have to work under the management of a dentist, like Texas. Then there's states where a hygienist has to be in collaboration with the dentist. They have an agreement. Anytime they see anything that is beyond their scope, they refer to a specific dentist. And then there are states where hygienists work completely without the supervision of a dentist. Those ones who work in like health professional shortage areas are typically able to serve the general population, whereas those who are not working in those areas, like the non-designated health professional shortage areas, may only be able to provide care to specific populations, like low income or uninsured or a homebound patient. But there are mobile practices like that, like vans who go here in Texas. We have mobile dentistry going to like nursing homes, but we still have to have a licensed dentist. Okay, so this slide is really more so for offices or hygienists who work in states where this is allowed. But for starting a practice, maybe you move up to Wisconsin or Minnesota or Washington or somewhere where you can open a practice. And I mean, good for you. Go for it. I mean, if you want something, like now is the time. Do it. Um, and so if you would like to start a practice, the first thing you need is a business plan. Then you develop a financial plan for how you can go about, not only getting the funds to start, but also how you'll function afterward in order to make the money back. Then you'll choose a location. You usually will choose a mentor who can help you, other hygienists who've opened practices. It is a really good source there. And then you're also going to need to talk to the dentists in that area in order to know who to refer to whom and when. You're going to need social media. You can't start a business without social media these days. And then you're going to need to hire skilled staff. You need to hire people who are when you're first opening a practice, that's not the best time to be training everybody. Okay, so a lot of the people who you bring with you into a new office need to kind of know what they're doing already. You need to obtain insurance for your business. And then you need to make yourself visible, right? You need to get out there. So, some of the ways to get visible too are by going and talking to local or state or even like national dental societies. If you are in this kind of area, you will need to attend continuing education courses, just like you need to do so here. But it's even more so important there because you're functioning in an expanded function, and then you're going to need to refine your leadership skills. So if you are owning a business and you are not working on your leadership every single day, then your employees are probably not happy and they will leave you. And you need to listen to your patients. So if your patients are saying that your fees are too high, then if one person says it, it's like, okay. If two people say it, you're like, well, maybe the fees are too high, but I'm going to be fine. If a lot of people are saying your fees are too high, well, then they're probably too high. You need to review and modify your business plan as you go. So, if you're turning just a tiny little profit, but you're, supply and demand, right? So if you are selling a ton of whatever it is, maybe you're making bleaching trays and you're selling them for $50, and everywhere else in town is selling them for 100. Well, you're making a lot of bleaching trays. You're working pretty hard, but you're not making that much of a profit. So you might bump up to $75 for your bleaching trays, so that you get a little bit more money, but you still undercut the rest of the community. But anyway, consider associateships in the future, and you need to plan for retirement. If you're owning your own business, there is no 401k there, so you're going to have to open up a Roth IRA or something. All right, so you made it this far, all the way through the very first lecture of your term 7. Well, maybe it's the first lecture of term 7. I don't know. Maybe you've listened to another class before me already, but I feel like it's pretty early in term 7. I don't know.